Bismillah ar-Rahman ar-Rahim. Today we are going to speak about introduction to classification of periodontal diseases as a part of professional skills 3 course. I'm Dr. Iman Khair. It's actually a very simple lecture, and it introduces you to the classification of periodontal disease, which you will take it or you will consider it in details in the during your 4th and 5th year. As introduction to our lecture, we are going to speak about what is a classification, what do we mean by classification, and why do we need classification. And we have to shed light about the classification journey, and we have to focus on the last classification, which was in 2017. And we have to know, is it important to understand it? Is it important to know what is classification? As you are still in the preclinical stage, I assume that you don't know what is periodontal diseases. What is periodontium? And maybe during or in the first lecture of the Professional Skills 3 with Dr. Inaz, you knew about what is periodontium and what is periodontal diseases. Okay, so let's just talk about the periodontium. We know the tooth is surrounded by tooth attachment apparatus, or we can say الجهاز الحامل للسن مثلا، تمام، which is composed of 4 main structures or tissues. Number 1, this is the gingiva, the soft tissue that surround the teeth. We can all see it in the mirror. The soft tissue, which is coral pink in color, that surround the teeth. Then there is cementum. Cementum is a part of the tooth that cover the root. We know طبعا this is crown. أكيد حتكونوا عارفين الكلام ده من morphology. This is the crown of the tooth, and this is the root of the tooth. والroot هنا is a multi-rooted. This is bi-rooted أو a tooth that have 2 roots. تمام. طيب دي هنا الأولى. This is the gingiva. تمام. This is the cementum, which cover the tooth, the root surface. This between the cementum and we do have this is a bone, compact and cancellous bone, and between them is periodontal ligaments اللي هي دي زي الاستريشن الموجودة دي. تمام. و this is soft tissue, while البون والcementum are hard tissue. صح؟ okay, let's go to what is classification. Classification in Arabic is التصنيف أو categorization، إنه نخوض كل حاجات اللي بتشبه بعض in category. تمام. طيب هو we can define it as a systematic arrangement in group or categories according to established criteria. التصنيف بتاع periodontal diseases في حاجات بتشبه بنسميها periodontitis، في حاجات هنسميها gingivitis and so on. طيب classification system are necessary in order to provide a framework in which to scientifically study the etiology, pathogenesis, treatment of diseases in orderly fashion. It is also necessary for clinicians to properly diagnose and treat patients, as well as for scientists to investigate etiology, pathogenesis, natural history, and treatment of the diseases or conditions. طيب, let's imagine that you have a patient and you come tell me, doctor, I have patients with gingivitis. You know by now itis is inflammation, right? So if you say I have a patient with gingivitis, you categorize, you put the disease in a group that called gingivitis, and the criteria that I will expect in this patient is a patient with inflammation confined only to the gingiva. If you come and say, doctor, I have a patient with periodontitis, I knew that you mean the patient, the inflammation extend beyond the gingiva and extend to other supporting or tooth attachment apparatus like a bone, like periodontal ligament, and so on. So it make it easy for me to, then I can make a plan for the first patient. You should go for scaling or cleaning of the area and so. While for the second patient, you need to go for different modality or strategy of treatment. So you see now, it make it easy for you to diagnose, to put the patient in category that you need to put the patient in. Number one. Number two, it make it easy for us to communicate. Instead of saying I have a patient with inflammation in the gingiva bleed and it is edematous with so, you can easily say I have a patient with gingivitis, and I will know what are the criteria or what are the clinical features of this patient. Okay, so it make it easy to communicate, and then I will tell you, and we will put the treatment plan based on the diagnosis you put, right? Okay, so for the journey, it start earlier in 1966, and then till the last one was in 2017. Through this journey, we have main stations. Number one is a classification system for periodontal disease that was in 1989, and then in European classification in 1993. The American made some amendments in 1997, American Academy of Periodontology, and then the last one, and then the both work of European and American gave the birth to the 1999, which is now replaced by 2017. So why do we need to change every time? Because sometimes there are shortcomings which include considerable overlap in disease categorization. Sometimes you find there are overlap, and then absence of a gingival disease component, inappropriate emphasis on the age of onset of the disease, and rates of progression, and lastly, inadequate or unclear classification criteria. So, generally speaking, we would say we need every time they found shortcomings or نقول عليها سلبيات تمام في one of the classification, so they need to amend to make some amendments for the disadvantages or shortcomings. So to include a new feature which is very important that make it even easier to communicate, to diagnose, to plan the treatment. Okay, so they keep on changing, and now the last one they put the peri-implant diseases. You know now implant dentistry, which is replacing teeth with an implant اللي هي زراعة الأسنان, is a very important branch of dentistry, and people now move or it's getting more importance due to favorable outcome, if we say, instead of replacing teeth with removable denture or with crown and bridge that need to reduce some teeth. Here, implant dentistry is nowadays playing a critical or crucial role in replacing teeth. So when we place implant inside the bone, we're replacing the root. So we are dealing with the new tissues, which is peri-implant tissues. The mucosa around the implant, we can treat it as the way we treat gingiva. So instead of saying gingivitis, we say mucositis, because gingiva is no longer here, but the mucosa is surrounding the implant. Okay, so in the last one we include the peri-implant tissues and the diseases, of course, in addition to other criteria. So the World Workshop on Classification of Periodontal Disease and Peri-Implant Diseases and Condition, a workshop was co-sponsored by American Academy of Periodontology AAP والEuropean Federation of Periodontology, اللي هما this is the two main bodies that govern the periodontal issues, and included expert participants from all over the world. An organizing committee from AAP and EFB were charged with updating the 1999 classification of periodontal disease and condition and develop a similar scheme, okay, for peri-implant diseases and conditions. So this is the main one. The other thing is that the last classification considered the risk factor, okay, responsive to treatment or rate of progression to determine the grade, while the tissue destruction or severity is stage, and now it is clear. So when you go to the fourth year and start your patient, you need to tell the patient is according to classification of 2017. You will need to tell the patient have the grade periodontitis, the grade and stage, and give a comprehensive view about the patient. طيب new classification of course stage reflect disease severity, while the degree reflect the rate of progression. So you will determine or say the degree of progression based on the risk factor rate of progression in regard to age and other criteria. Okay, so you will have a detailed lecture about classification 2017 before you start your patient, because when you have a patient, you have, prior to treatment, to treat the patient, you need to diagnose. And now people are moving toward diagnosing patient rather than treat. If you know, if you properly diagnose the patient, you can easily and properly manage the patient. So you will know in detail how to say this is a gingivitis, what are the criteria, and this is periodontitis, how to determine the stage, the severity, the degree, okay, the rate of progression, and to determine this in the diagnosis section. And then according to that, according to this finding, you put your treatment plan, and you can easily tell what you think about the outcome of the treatment. You can easily talk about the prognosis of your case. So as we said earlier, classification is very important. I think you should be familiarized with this. This is an X-ray showing a bite wing view, right? Showing upper and lower teeth. Okay, I just want you to see here the crown. In the crown you see the enamel, right? And the dentine, and then here the shadow, or the, you see here it's a bit blurred, this is the bulb, right? And here this is interdental bone. You can see there are two parts. One is whiter than the other, which is the whiter is compact bone, right? And this is the outer layer of the bone, and in the middle here it's a bit blurred, which is cancellous bone, right? This between the two teeth, and here you can see the pulp even, right, on the other tooth, which is the fifth in the middle like a line. This is the bulb. Okay, then another view, this is also to show you the coronal, the root, the gingiva, periodontal ligament, and the alveolar bone, right? Okay, let's see here. We will talk later about next week about gingiva. Look at this healthy periodontium. I would say here, yes, healthy periodontium. Look at the gingiva. Look of interdental gingiva. Look at the so-called stippling. We'll know about it later. The margin of the gingiva. Okay, so this is what we call healthy gingiva. I'm sorry. Let's go back.